Oh, there's the light. Okay. All right, my name is Carrie Morris and I'm here with Elise. We're going to be doing a assessment for the health and physical class. Can you tell me your name?
Elise Henderson.
And your date of birth?
06/1991.
All right, and for purposes of the video, you are giving me permission to perform an assessment on you on video.
Yes.
Okay, good. All right, so this is going to be it's a neuro assessment with the ENT assessment as well. So the first thing that I'm going to do is I'm going to inspect the head, and when I inspect the head, I'm also going to be feeling the scalp, seeing if there is any abnormalities or bumps or any problems with your hair. We'll be looking at your face to see if there is some symmetry. Can you smile for me? Good. All right. And making sure that everything is as symmetrical as it should be. I'm going to find the temporal artery. There we go. And then below the temporal artery is the temporal mandibular joint. And to assess this, I'm going to ask you to open your mouth. All right, perfect. Close it. Okay. And everything is nice and symmetrical. And then as far as your face, I'm going to be checking out and palpating along the sinuses. Let me know if I create any pain here. No good?
Yep.
Okay. So we're going to move on to the eyes, and with the eyes we're going to be doing some inspection. Inspection is first, so I want to take a look at the eyes, look at the external part of the eyes, the eyelashes, and make sure that your eyes are not swollen or edematous. And then I'm going to go ahead and inspect the sclera, see and make sure everything is nice and white, and then the conjunctiva is pink as it should be. So we would be doing a visual acuity test with the Snellen's chart. That is the eye chart. You have seen that, right?
Yes.
And you've had that done before, correct? Okay. I also want to check your the peripheral vision. So you've got four peripheral fields here that I want to check. So in doing that, I'm going to ask you to look forward. And then tell me when you can see movement.
I can see your fingers.
Okay. And?
I can see your fingers.
Okay. So I'm checking, you've got four fields here of vision. So we were checking those fields with the confrontation test. I want to take a look at your pupils. And our pupils, we're going to look at the size. So would do this normally in a darker area so I could get better look at the pupils, but I'm going to go ahead and shine the light in your eyes. Pupils are beautiful. Very reactive. Look straight ahead for me. Okay. And then I'm going to look at direct and indirect consensus. And in doing that, I'm going to bring the light up and I'll look at the pupil of this eye. Look straight ahead for me. Okay. And then I'll do that again. Look straight ahead. And in doing that, I should see the pupil movement on this side as well as that side. So look ahead. Okay. And again, look ahead. And I can see the movement on this side. I also want to check your, you have equal round reactive pupils. Your pupils are pretty much perfect. And I would probably call them about a 3 if I was doing the size of them. Nice. And then the next thing that we're going to do is some extraocular movement. And this is your cranial nerve 3, 4, and 6 are in charge of all of this extraocular movement. So what I need you to do is follow my finger.
Okay.
Look right here. Okay, we're going to go this way. and then up, and then down, up, back to the middle, over here, and up, down, and back to the middle. Perfect. So that was the 6 cranial positions of 6 cardinal positions of gaze, and they were all good. I'm going to go ahead and grab this. We're going to check out and inspect your lenses for clarity and also for reflex. I am going to have you look straight ahead, and I'm not real used to this tool. Let me take a look here. And what I'm looking for when I do that is the light reflecting off of the pupils, and then looking to find the red light of reflection in the pupils as well. Look at. There we go. And I can take a look at the blood vessels and the eye fundus. And of course, we're doing both sides to see if there's any abnormalities. Okay, that was pretty cool. All right. So the next thing that we're going to do is our ears, and inspection is always first, so I'll check out the ears. I've got nice little, lots of earrings here. So check out the ears, check out the size, the shape, see if there's any swelling. Want to pull up do a tug test on your ears where I'm pulling up the auricle of your ear to see if there's any tenderness, pushing on the tragus here to see if there's any tenderness. Everything good?
Yep.
Okay. And then over here as well. Good?
Yep.
All right. Then I'm going to take a look at the ear canal. Taking a look at the, not very good at this thing yet. Taking a look at the external ear. Oh. And then in we go, looking at the internal ear, checking out the tympanic membrane, just looking to make sure that there's no, oops, that's coming off, no redness or discharge. There we go. I had this earlier, worked great. And make sure there's no wax buildup, nothing like that is in the ear canal. And then, of course, I would do the same on the other side. I can also do, for hearing, we can do, which this is dealing with the cranial nerve number 8. Your cranial nerve number 8 is all about your hearing, and so what I'm going to do is I'm going to do what's called the whisper test, and you can tell me what I say.
49.
Perfect.
49.
Okay. It's a 2-syllable word, just to check and make sure that your hearing is intact. And then we also have our tuning fork here, which can be used to feel and hear vibration. So if I do this, you feel it?
Mm-hmm.
Okay. Feel the vibrations?
Mm-hmm.
And then for hearing, there we go. Put it over here on the mastoid bone.
Mm-hmm.
You feel it?
Yeah.
I'm going to wait for it to stop. Now you can tell me if you can hear it.
Yes.
Okay, it's kind of cool, huh?
Yeah.
That was the Rhine test. So the Webster and the Rhine test for hearing and vibration. Next, we're going to do the mouth and the nose, and I really need this to work for me. So let's see. I did this earlier. Knew I could do it. Knew I had it. When I take a look at the nose, we want to make sure that both sides are patent. Breathe in, no problem. Breathe in. I'm going to look for any deformities. Inspection is first. And then I can take a look in the nose. There we go. Make sure there's no bleeding or swelling or any drainage, nothing like that going on. So next thing we're going to do is we're going to take a look at the teeth and the gums. And I'm going to use my little light here. This seems to be a pretty good light. So looking at the teeth and the gums, you want to look and see if there's any missing teeth, dentures, inflammation, any infection, any dental cavities, lesions, anything like that going on with the mouth. So if you could open your mouth up for me, stick your tongue out. All right, good. And then with the tongue and the uvula, I would like to look and make sure that the tongue is symmetrical. Open up and say ah. Say it again. There we go. So the uvula is there. It works well. You've got good verbalization as far as the ah sound. And the tongue out, that is your, we're dealing with the swallow reflex, which is cranial nerves 9 and 10. And then the tongue protrusion is cranial nerve number 11. I also took a look in to take a look at the tonsils, see if there's any white exudate on any of the tongue or the throat. Everything looks good. And then I also want to do some palpitation here as far as your tonsils, see if your lymph glands, see if there's any swelling. No swelling in the neck as far as the lymph glands. That'll be it for that. So we went over the cranial nerves. Your cranial nerve number 1 is your optic nerve. Number 2 and number 3 were the ones that were dealing with the pupil reaction. That is vision and pupil constriction. And then cranial nerve number 3, 4, and 6 are dealing with your extraocular movements, where we were moving up and down, your downward eye movement, facial sensation. Number 5 is facial sensation, sorry. And that is also when you open and close your mouth. You open your mouth up, okay. Close your mouth, okay. Then you can feel on both sides for facial sensation. Cranial nerve number 8 was our acoustic, your hearing. Our swallow reflex is our cranial nerve number 9 and cranial nerve number 10, the glossopharyngeal and the vagus. And then cranial nerve number 11 is the spinal accessory nerve, and that is related to the trapezoid muscles back here. It allows us, if you could shrug your shoulders for me, it allows you to lift up your shoulders, give you a good shoulder shrug. And then the hypoglossal was the tongue movement. When you stick your tongue out, it should be symmetrical. Stick your tongue out. It should not be varying from side to side. Neuro patients a lot of times will have a tongue deviation. It should be midline. We're also going to do a assessment of your cerebellar function, and I'm going to have you do this little test with me. If you could pat your knees. So pat your knees and then pat them with the top of your hands. And then I want you to do it as rapidly as you can, back and forth. And that is a normal finding. You are normal. You can do rapid movements, back and forth, rhythmic movements. Then also wanted to do some testing of the sensory. And with the sensory, I am going to ask you to close your eyes. And I am going to let you touch that. What is it?
A hand.
Okay. So with that, you would put a familiar object, probably something smaller would have worked better, but a familiar object in the palm of your hand and allow you to identify it. And then the graphithecius is also a sensory test where we would have you, I'm going to write a number down and you can tell me what it is.
4.
Mm-hmm. Good job. So the other one that I wanted to do with you is it's with a bobby pin, and the bobby pin has 2 points. And when I do this with you, I'm going to ask you if you could tell me how many points I'm using. So close your eyes.
1,
Okay.
2.
Okay. And that's called the 2-point discrimination testing. And for your hands, you can usually tell, but once you get down to, close your eyes, once you get down to the legs,
2.
okay. Sometimes it's a little bit difficult with your lower extremities. The other thing that I wanted to do with you, I would normally with my patients watch you as you walked in and seeing your gait and all of that. But let's go ahead, if you could stand up right here for me. And turn around and face me. And just walk to me heel to shin. There you go.
Like that?
Yep, there you go. Perfect. So you have great posture. Go ahead, step back. If you could walk to me on your toes. Perfect. Balance is good. And then one more time coming to me on your heels. Good. Perfect. And no pain with that, right? Okay. So we would check that. That would be a Romberg sign. If you had pain, we'd be questioning whether you have a DVT. Wanted to do some reflex testing here. So just rest your arm out here. I'll hold it up for you, okay? And there we go, just like that. So we're going to see if I can do this. There you go. Perfect. That was kind of weird, isn't
Yes.
it? Yeah. So that is your brachialis, brachial, I can't say it, so the brachial nerve here. And up here, and it's your bicep. So, yep, you can see your thumb twitch a little bit. Just relax this. I'm going to actually hold it up. A little bit. Not much. I didn't want to do it too much. I hate it when people do that to me. And then, of course, the patellar, which you can feel this little notch right in here where your kneecap is. You've got weird knees too. All right. Just relax. Anyways, okay, so I think I got it all. We've got ears, eyes, cranial nerves, mouth, nose. I'm going to make sure and check the thyroid up in here. I don't know if I had caught that earlier in the, and then we checked out the lymph glands up in here, down in the substernal notch down in here and up in the neck. Okay, so anyways, that concludes our test. Thank you very much from Elise and Carrie.